Hello, and welcome back to another episode of Straight Up With Steph. Today, we've got another conversation about fluoride and nano-hydroxyapatite. Today, I'm interviewing Dr. B, aka Ask the Dentist. He's got hundreds of thousands of followers on both Instagram and TikTok, and he talks a lot about holistic dentistry. He's a functional dentist, and if you don't know what that means, we will talk about that. And he talks about things like nano-hydroxyapatite, fluoride, but also other things, supplements, environmental concerns. Like if you just want to learn the real deal as far as health and things to do and things to not do, highly recommend that you follow and listen to Dr. B. And while he, I'm sure, could educate us on a million things and we could have talked for hours, we tried to narrow down the conversation today to fluoride, the issues surrounding fluoride, the controversy, is it toxic, is it not, and also hydroxyapatite, more specifically, nano-hydroxyapatite. It's a really exciting time right now because we have options to give our patients in nano-hydroxyapatite products. According to Dr. B, these work just as good, if not better, than the traditional fluoride products that we're using without the systemic or brain concerns that we're hearing about now. It's so important for us as clinicians to recommend the best things for our patients and stay on top of the research. And it is okay to change our mind. I've said it before and I'll say it again. If we're practicing long enough, likely there is going to be research that comes out that is against what we've been taught or things that we've been recommending. And that's okay. Once we know better, we do better, right? And that's our job as clinicians. I really hope you enjoy this conversation today with Dr. B. Hey, it's Steph, and welcome to the Straight Up With Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Dr. B. Thank you for joining today.
Hi, Stephanie. Great to be here. Thanks for having me.
Yes, I'm really excited that we have time to sit down and chat. I met you last year at RDH Under One Roof very briefly, and I was really excited to see you at that particular conference. Why did you choose to go to that show?
Well, that particular show, I really didn't know about the RDH Under One Roof. I subscribed to the magazine, of course, online, and I learned a lot, but we accepted an award for our varnish. It was a Celerant Award. The staff and all of us, all the founders of this of our company that produced this product, we said, we better go, if we're going to get an award, let's pick it up. It's actually sitting right behind me here. And we're very proud of it because it really is a first of its kind. And we thought it was very interesting and ironic, but not surprising to us that it was that hygienists appreciated this product and this new category before anyone else did. So I went there to accept the award. But again, I'm going again this year in Dallas. I was just so impressed, met so many interesting people, learned a lot. And as we talked about earlier, registered dental hygienists are the ones that are doing all the educating. And that's what I'm doing. So I'm just hanging out with like-minded people and learning and also getting them educated. And then by getting them up to speed on everything that's new in dentistry, that's what gets out to the population, the populace, patients, but also to other dentists. So it's one way to get to other dentists. Dentists tend to be very busy and very directed, and that's normal. They're the clinicians and in terms of the restorative work, and so they don't have a lot of time to absorb this. So we're going to sneak in through the open-mindedness of registered dental hygienists and get this information out.
Yeah, and I'm excited to talk about that product a little bit later. But I remember when you and I set up our first Zoom call, it's very expressive on how pro-hygienist you are. And I love that, of course, because I'm a hygienist. But,
Right.
there's a lot of friction right now. So it's just really nice to hear how supportive you are of us. So thank you.
Oh, absolutely. Thank you for all the work you do. I mean, you spend more time with the patient than we do over the years.
Yeah, we definitely build those strong relationships. But with you, there's a lot I want to talk about today. But to start off, you are a functional dentist. Can you explain what that means to someone who doesn't know?
It's a different approach. It's something that developed over time in my practice. It's not something you get in dental school. It's a philosophy, but it's also a protocol, and it is looking at oral health in a more global, bigger picture and how it affects systemic health. The analogy of a stream in terms of healthcare is often used, and you're practicing upstream. You're looking for root causes. Instead of just reacting to the cavity and fixing it, which we're really good at, or if it's a hygienist and there's a deep pocket and there's a big piece of calculus, subgingival. And I mean, we're very good at addressing that. But what about preventing it from happening to begin with, and then acknowledging and understanding why does that cause disease? And if we know the why, then we're better at the preventing. And then also working or thinking in the prodromal phase of disease. In other words, instead of waiting for the cavity to appear or the recession or the inflammation, the inflammatory response to the gums, why not see it earlier or recognize it earlier so that the treatment is more effective? I mean, gum disease is the perfect example. Once it's on board and fully present and visible, and the symptoms are there, receding gums, necrosis of the free margin of the tissue, inflammation, that cytokine response, bleeding points, it's kind of hard to fully reverse. We're more interested in just arresting it, although newer protocols are coming out. But if we looked at it from a functional perspective, we would never be in that position to begin with. So you could call it integrative, holistic. What are the other words? I mean, there are many other labels that are similar, but functional, I think, is a broader term. And functional medicine has really taken hold, 20% maybe of the market. And I think it's important that dentistry follow that and follow the similar definitions and terminology, because again, that integration between medicine and dentistry really sucks. It's just, there's a chasm between our two professions. So we might as well go along with that and ride that wave of functional medicine, functional dentistry, but it should really just be functional overall health.
Yeah, no, I agree. I know myself personally, just with my own health and medical care, I am going down the road of functional medicine now. Our traditional medicine, I've just had some issues over the past couple of years, and it is so reactive. And that's not how my brain works. I'm a hygienist, I'm preventive. And I have had a guest or a few guests on actually recently talking about hygiene, and we say that we're preventive, and in a way we are, but when we're looking at patients and we're probing or we're taking x-rays, we're looking at disease that is already there. I mean, what if we could do some bacterial or microbial testing to see the periobacteria before it causes damage and truly practice prevention? So it's just a really exciting time in dentistry because of all of that.
Agree. I remember in dental school, we were told, this is 40 years ago, we were told that dentistry is more preventative than medicine. And over the years, or the decades, I've realized that, maybe our approach is a little wider in terms of looking ahead, but it's not as wide as it should be. And of course, medicine is pretty narrow, very reactive, but functional medicine is not. And so we're reacting as practitioners, whether it's a hygienist or a dentist or a physician, we're reacting to that narrow scope of treatment because we know it doesn't work and it frustrates us. And when we go home at night, we know we haven't done our best for our patients. And so this is where it evolves. Continuing education, podcasts, books, all of that.
It is really exciting. So with your interest in like true prevention and overall health, is that kind of what inspired you to create a Nano-Hydroxyapatite toothpaste and other products?
Absolutely. So over time, again, we don't get this in dental school, but it took me a little bit of time, but I realized that oral care products were causing a lot of oral disease. Actually, well before I was a dentist, as an older teenager, I was reading a lot of books, and this is weird, but I was reading a lot of books on longevity and biochemistry and supplements, and that was kind of a hobby of mine, and also regenerative farming. And this was back in the late 70s. And
you were a teenager?
I was a teenager.
Like learning?
Yeah.
Wow.
Yeah,
Like, that's
I was a
impressive.
nerdy teenager. I was playing soccer and doing all that fun stuff too, and tennis and skiing, but that was kind of where I was going. And anyway, but I had formulated an opinion on fluoride. I thought, this is crazy. And again, I had no scientific data back then. It was part of a conspiracy thinking and communism and, or government control over IQ. The irony is that there is an IQ component now that we have the studies. But back then I thought, that just doesn't seem right. And then when I raised my daughters, my three daughters, I immediately bought a distiller. I literally bought a distiller while my wife was in 36 hours of labor. There were a lot of breaks. We were waiting to induce. I went down, had just started my practice. I went down the street to buy a copier because I needed one, and then I bought a distiller because I knew that I didn't want to expose my kids to fluoride, but I didn't have the data back then. So fluoride products that were disinfecting the mouth, again, I didn't know about the oral microbiome back then. I kind of kept to myself. You wouldn't speak out against fluoride in dental school. That just wasn't done. But I had those opinions. And then over the course of practice, I realized that we were doing a lot of things wrong. And so one of those categories was changing the oral care industry and the product line that was available, and to change that way of thinking that we need to disinfect the mouth. And the mouth is a dirty place. And I mean, this is a philosophy that came literally out of a covered wagon of a snake oil salesman selling essential oil, strong essential oils to farmers and cowboys that, were eating a lot of grains. And this is back in the late 1800s. I mean, that way of thinking has to change. So that's where Dr. Stacy and I and my daughter were the three founders of Oral Microbiome Solutions, OMS, which has created this product called FIG, which is a feed your good guys kind of concept. That's what it stands for. It's a toothpaste, it's a varnish. We've got another product coming out in a few months. That's where that thinking came from. I mean, we know about the gut microbiome. We know we don't want to disinfect that. We don't want to consume emulsifiers. That breaks down the bugs in the gut. But it also happens in the mouth. I mean, there are a lot of similarities between the oral and the gut microbiome. They're linked. They influence each other. But the point is that there is an oral microbiome in the mouth, and you need to respect it. You need to leave it alone, not disinfect it, and you need to feed it and nourish it. And sometimes you need to weed it, right? I get that. But that's where the impetus came from. And the other push was from our followers on Instagram. I kept recommending other toothpaste. I was an affiliate for Risewell, for Boca. Those were my favorite brands because they brought a good, safe, approved version of Nano-Hydroxyapatite to the U.S. market. But they had other issues, surfactants and emulsifiers. They weren't perfect. I was very honest about that. And I got a lot of, not flack, but confusion from followers saying, well, okay, you're recommending it, but you don't like emulsifiers, for example, or essential oils. And I go, I know, but if you want to remineralize your teeth, that's the only product on the market. And then finally, after I met Dr. Stacy, and then a lot of pushing from my daughter, saying, Dad, come on, let's make the ultimate toothpaste. That was the other push. So it was kind of a organic thing that grew over time and frustration, and it's beginning to change. I mean, we got the award. We have a varnish that, according to a study that is embargoed until, I think, March 15th, because it hasn't been presented yet, we outperform varnish, the number one selling fluoride varnish on the market.
Wow.
Our toothpaste outperforms other Nano-Hydroxyapatite toothpaste because we took out the emulsifiers and we got rid of the essential oils. We're feeding the good guys. And then our new product will be kind of more of a push into that concept of really feeding the good guys and producing maybe systemic effects and improvements. So again, we're just trying to change this category of oral care. Let's stop cleaning the mouth and disinfecting it. Let's get with the game. Let's support the oral microbiome, make it happy, give it what it needs. The body takes care of itself if you know what the root cause of oral health issues, dysbiosis, disease, cavities, gum disease, canker sores, bad breath, that all comes from abuse of the oral microbiome.
Yeah, and this just goes back to your philosophy, right, of practicing this holistic functional dentistry. I remember back when I was in hygiene school, and I've been practicing for almost 17 years. So this was a while ago. One of our instructors who was anti-Listerine, she was just like, I don't recommend Listerine. It kills all of the bacteria in the mouth. And then there was another person who was pro-Listerine, and he was like, I don't understand why she doesn't like Listerine. And this was back then. And it was almost taboo for us to talk about not using a really strong mouthwash, not using fluoride. So I'm just glad that these conversations are becoming more accepted and we can talk about it a bit more openly now.
Yeah. Well, your instructor, she was ahead of her time.
Yeah.
And that was actually 17 years ago, would have been just before the time where the studies came out indicating that a mouthwash like Listerine causes high blood pressure. And it does that by taking down the oral microbiome, the ones that produce nitric oxide. I mean, it's so clear to us now, but in hindsight, I'm just sometimes horrified what we were not discussing and recommending. So good for that instructor. You should reach back to her and say, you were right on.
It's got to be so validating for her now, to hear stuff like this. So going back to nano-hydroxyapatite, how does it work on the tooth surface and how is it different than fluoride?
It is different. It is similar. I mean, they've both been well studied. We understand, and I'm talking about topical fluoride. I always make that differentiation because a lot of people get confused or they group it all as one. A lot of dentists do that. It's like, do you ingest it? Is it in the water? That's a different mechanism and less well understood and less studied. Not less studied, but has weaker evidence of efficacy. But topical fluoride does work. And there are different types of fluoride. There's stannous and sodium fluoride. And we've been playing with it for a long time, I think 75 years. And then, of course, it's been added to toothpaste. But essentially, both of these substances, and they are remineralizing agents. They have free ions. They're very electronegative. Fluoride is very reactive, more so than hydroxyapatite. And it combines with the opposite charge in the mouth, and that could be a demineralized tooth. So fluoride and hydroxyapatite, and when I speak about hydroxyapatite, I'm going to refer to nano-hydroxyapatite. There's a micro version, and there'll be a time where we can talk about the differences, but nano is a better product in terms of therapeutic effect than micro. And we can talk about that, but when I refer to hydroxyapatite, it's going to be typically nano, unless I differentiate and say it's a larger particle size. But they both remineralize teeth. Fluoride, as we all know and been taught in hygiene school and dental school, is that it combines with the apatite crystalline structure of a tooth, and it creates this kind of Frankenstein molecule, if you want to call it, mineral. It's called the fluorapatite mineral, and it is resistant to acid. And so when you eat and you have this acid attack, the pH drops in your mouth, wherever that fluorapatite ion or crystal is, it's less likely to dissolve and become a cavity. And that was a big news. When I heard that in dental school, it's like, well, that makes sense. That's pretty cool. Yeah. Well, hydroxyapatite, nano-hydroxyapatite, also combines with demineralized opposite charged areas of the tooth during an acid attack. But it does so differently. It penetrates a little bit deeper. It's a smoother finish, smoother surface, so it looks wider. There's more reflectivity. Fluoride is a very brittle external covering of that area, where the nanoparticles, because they are smaller, and they are also biomimetic. In other words, hydroxyapatite is what is in the tooth. Fluorapatite is, and that's why we call it this Frankenstein molecule, it's different. It's fluoride combined with what is in tooth structure. And so when the nano-hydroxyapatite integrates with the tooth, a demineralized tooth, and it's trying to remineralize that area, and it's being dissolved out of saliva, it penetrates more deeply. That's why it works better for desensitization. It's a smaller particle size, and that's probably why it integrates deeper into the surface of the tooth. It's less brittle. It's more flexible. I mentioned that it absorbs light differently, which is why nano-hydroxyapatite has that whitening effect. It doesn't actually change the color of the tooth, but it does make them look lighter and whiter. Fluoride just works on the surface. Nano-hydroxyapatite is more of a direct enamel repair, and it tends to stay around longer. Now, you can always demineralize a fluorapatite area of the tooth. You can always demineralize a recently remineralized nano-hydroxyapatite area, and especially the nano-hydroxyapatite. That is natural tooth material. So if you keep hitting it with acid, and you're eating like goldfish crackers or candy or processed carbs, it's going to be hard to keep that area from remineralizing as opposed to demineralizing. That's just the nature of that dynamic, the Stefan curve, all of that. The body can't keep up. It cannot fix that area. So both are vulnerable to that. But here's where things get very important. Fluoride is toxic to a developing brain. We have plenty of data. There was a lawsuit against the EPA, which the EPA lost, although they're appealing it. Fluoride is not necessarily naturally found in tooth structure, although it is naturally found in our environment, but typically it can be very toxic. It's almost like arsenic or iron, other minerals that if you get too much of can be quite bad. And of course it causes fluorosis. Hydroxyapatite does not. Fluorosis is actually too much fluoride. Modeling, it can be white, then it can be brown, and then turn black, and it tends to decay even more readily than an area that is just normal enamel. So overall, they both do about the same thing. There's plenty of data that says fluoride works, but fluoride is a toxin. So if you have something that performs as well and sometimes better, like in the reflectivity component, deeper penetration, better for desensitization, then why not use the biomimetic material, the material that already is in your tooth? As long as you can get a good version of it and a safe version of it, which we can talk about later, it's clear that hydroxyapatite, this is why hydroxyapatite is taking the market now and becoming more popular. It's been around for 40, 50 years. The Japanese have been using it in toothpaste that long. It was NASA that developed this product for bone density in 0G gravity. The medical industry has been using it for at least 40 years, 35 years in prosthetics. They actually use it also in targeted therapies. They can bind certain pharmaceuticals or active agents to these nano-hydroxyapatite particles, even micro-sized particles, and then they can target certain organs and areas, like cancer and that kind of thing. So it's been in use for a long time. It's nothing new, but it is new to the U.S. market. So essentially they do the same thing. One is just safer than the other and slightly better and longer lasting and better looking. I mean, I think that's the best thing I can say about that for that question.
Yeah, no, that was great. When we're talking about the toxicity of fluoride that you mentioned, is that systemic fluoride that we're talking about or topical or both?
All the studies refer to systemic fluoride. However, fluoride is absorbed and becomes, if it's in toothpaste, if it's in a varnish, the varnishes really worry me. I think varnishes started around 24,000 parts per million of fluoride. That is absorbed via the oral mucosa. I mean, like the gut, the mouth has permeability. It has permeability unique to the gut, and that is past the junctional epithelium as well. But let's just take the oral mucosa. And there are plenty of studies. In fact, a lot of dentists said that didn't absorb through the oral mucosa. And then I would come up with some rat studies. They're rat studies, but they're well done back 15, 20 years ago, where they could measure the amount of fluoride in the bloodstream of a rat within 10 minutes. And it was whatever you gave the rat was in the blood within 10 minutes. And fluoride does cross the blood-brain barrier. So is there a place for topical fluoride in low doses, maybe in toothpaste? I don't think it really works well in toothpaste. I don't think it's strong enough. Does a topical varnish work with fluoride in it? It does, but you're getting a big hit to the brain with fluoride. And I don't think children should be exposed to that. And the good news is that we now have, and we will have more, nano-hydroxyapatite-based fluoride varnishes that work as well, if not better. And that's what this researcher will be speaking to in New York at I can't remember the name of the organization, but it's where all the dental researchers get together, the remineralization experts, the oral facial experts, and they discuss their research. And he's very excited. It's actually his student that's presenting the study. He'll be presenting in Barcelona and then I think in Leeds in England at a university. And they're excited because this is the first time they have a good alternative, one that works better, slightly better, than a fluoridated varnish. So again, we have options. Why wouldn't you want the option if you're worried about brain health, even if it is topical? So I hope I answered your question.
Yeah, no, definitely. Going back to nano-hydroxyapatite and toxicity, are there any issues with that? Is it safe for everyone? Can kids use it? Can pregnant people use it? Can we swallow it safely?
Right. Yeah. All great questions. Hot topic on Instagram. Again, it's been around for a long time. We would have come up with something by now after 50 years of it in use in the medical industry, but also in the toothpaste industry. It's there. It's been there. We've been using it. The main concerns, and a lot of these are dentists that have a toothpaste formulation, but they don't have nano-hydroxyapatite. They were caught by surprise by the efficacy and the therapeutic effect and the movement towards this, because now that the interest in fluoride is waning, you better have a nano-hydroxyapatite in your toothpaste formula. So if they don't want to formulate, of course, they're going to say terrible things. So there's a lot of discussion on pineal gland calcification, kidney damage. It does cross the blood-brain barrier. I mean, I can get into all of that if you want, but the overall picture on that is that there are no solid studies that indicate that there is an effect on the pineal gland. There is on fluoride, by the way. There have been many, many studies over the decades that it can increase pineal gland calcification. Now, as we age, the pineal gland does get calcification. If you understand calcium metabolism, it's all about, it could be about high calcium without phosphate present. It can be oxalates. It can be low magnesium. It can be a vitamin 2 deficiency, and I'm talking about kidney stones. Of course, the pineal gland calcification, arterial calcification. These are all products of a poor calcium metabolism, which is very important, probably second in importance to glucose metabolism. If you don't have calcium in your body well regulated and other minerals, we're dead in the water. Again, magnesium is a big player. So is phosphate, which is in hydroxyapatite. You have to have the right ratio of all these minerals. And we live in a mineral deficient world right now. I mean, our soil, we used to get a lot of minerals from a lot of produce. We get less of that now. Now we're adding with electrolytes. Is that the right ratio? Are you drinking enough? Are you hydrated enough? These are all factors in calcium metabolism. Osteoporosis is on the rise. Arterial calcification, heart disease, of course, joint calcification. It has nothing to do with toothpaste. If you take a 4-ounce tube of toothpaste, which is what Fig is, and you take a dollop, which is about a gram, that's 12 and a half, 13 milligrams of calcium. A whole tube is about 1,200 milligrams of calcium. So if you were to swallow all of that all at once, it's almost like taking, I mean, a lot of people take 1,000 milligrams of calcium. I wouldn't recommend that, but you're taking a supplement of calcium. Hydroxyapatite does dissolve in solution. It ironically doesn't dissolve as quickly in saliva, and that's by design. Saliva is very mineral rich if you have good saliva, and that's what you want. You want to be able to carry those ions in solution so that they don't dissolve, so that when the tooth needs it, it's available. And that's how saliva works. It's a very unusual fluid, hypertonic, I guess is the word. Although a lot of us don't have that. We don't have enough minerals. We're mineral deficient. And then there's the size and the shape of the nano size. Now, nano is a 4-letter word, but remember, and I would never ingest a nano product if it was undigestible. But we're talking about a digestible product, and it's calcium. It's not a metal. It's not nano silver. It's not nano gold. It's not nano titanium dioxide. It's not nano zinc. These are all things that are not readily digestible. But again, it's been around for a long time in Japan. I'm not sure whether they're using a good version of nano, but there is now a safe version of nano. It's been studied for over 7 years by some elite scientists that are immune from any bias, corporate bias. That's the SCCS of the EU. And their final recommendation was a year ago in March. And there's only one version that's safe. It's made in Portugal. It is a 4-to-1 ratio particle size of 40 to 60 nanometers, rod-shaped, uncoated, no more than 10%. But that keeps evolving. They're now being petitioned for a greater strength, up to 20% in cosmetic products. So I don't think you really need to worry. I mean, my grandkids use this. I use it. These outliers, whether it's a dentist that already has a formulation or some people that do worry about it, and I get that. Nano is of concern, but they just need to delve further into the research. Nature magazine, very reputable, just came out with kind of an overall view, and they said, nano-hydroxyapatite, given if it's the right form, if it's synthetic, I think synthetic versions are better than ground up bone. Cow bones, even like bone broth, are going to be high in lead and arsenic. And also the particle sizes are unpredictable. But if you grow it in a vat from food grade salt and phosphate, it's checked for consistency of the shape under a microscope. I'm okay with that. It works. And it's what's in your tooth. If you were to cross-section your tooth and look at it under a scanning electron microscope, you would see nano. And this is a tooth that's unaffected by external nano. This is a tooth that's just erupted, that the body formed. It's made up of these nano-sized, 40 to 60 nanometer size hydroxyapatite crystals. And so that's all we're putting into saliva. We're putting it into saliva. Does some of it get absorbed through the oral mucosa? Yes, it does. Does it cross the blood-brain barrier? It does. It's like a calcium supplement. We need phosphorus in our blood, phosphates in our blood. We need all these minerals. It's important. And that's why I'm a big fan of magnesium too. Magnesium helps regulate that whole balance of minerals in our body.
I've seen some of your posts recently about magnesium too, just kind of your protocol and like the benefits of it. And I just love your content, by the way.
Thank you. It fixes a lot of things.
So much to talk about.
Yeah. And I thought I was okay with magnesium, but I started taking 7 different versions of magnesium. And again, that's what's found in nature. I don't want just some researchers to say, we're just going to make this synthetically and just give you this one version of it. If there are 7 versions, there are actually more. But it turns out those 7 are really important. I want it all. I want that whole mix because our body is complicated and it's looking for diversity and richness and all these different, if it's out there in the environment and if we can get it in a clean form, unadulterated, not polluted by mankind, and the body needs it, every cellular process in the body needs it, bring it on, please. Tell me where to sign up. Tell me who to give my credit card to.
Right. So if a dental clinician wants to start using a nano-hydroxyapatite toothpaste or even recommend it for patients, what are some things that they need to look at in a toothpaste? Because I'm sure that there's good versions and some knockoffs that aren't so good.
Right. Okay, I'll try and keep this very simple. And again, I told the story about Boca and Risewell, great toothpaste, but we wanted to take one step more. And this study that will be released soon indicates that our toothpaste and our varnish, but the varnish was tested against one of the best-selling varnishes. But the toothpaste, we compared all of our competitors to our basic tube of toothpaste, our mild mint. And we came out on top in terms of remineralization. And we really believe, and again, there's very little data on this, unfortunately. There's not a lot of money in research for toothpaste. But this was done at the University of Texas, and we feel that our toothpaste, the reason it remineralizes better is because we took a lot of stuff out of toothpaste. And that's kind of what we did in the very beginning. Our formulator, who was from Europe, he kept wanting to add things and, make our toothpaste unique. And we wanted to do the opposite. We wanted to be unique from a therapeutic standpoint, not from a marketing standpoint or what's on the box or the label, because we felt that a lot of these things were actually inhibiting the oral microbiome. And if you inhibit the oral microbiome, which is the engine or the mechanism of remineralization, it's the oral microbiome residing in the biofilm that coats the teeth. Again, the oral microbiome has other functions in all the micro-niches in the rest of the mouth. But in this case, it's those bacteria and enzymes and salivary proteases and lipids and all of those things. But it's this colony of bugs on the biofilm, on the tooth, and that's why there is a biofilm. It acts as a carrier for this mechanism or organ, you could call it an organ maybe, but this engine for remineralization. And we didn't want to impair that at all, so we took out all the things that we thought would impair it. Essential oils, botanicals, emulsifiers, surfactants, all of those things. For example, surfactant will break down the lipid layer of any cell, the outer wall, and that makes it difficult for these bacteria just to settle in the way they normally would. There's no data that says essential oils. In fact, there is some data that's like tea tree oil that it's not good for you. That's all Ayurvedic. I mean, I'm not saying Ayurvedic is bad, but that was observational clinical knowledge, and not all of it works. And now we have testing for the oral microbiome, so we can actually see the results of what these things do. Essential oils, eucalyptus probably being the worst, anise being, and these are all studies, anise being on the very bottom of the scale. So if we were to add an essential oil, it would be anise. But why add it if it's not needed? Why add it if there's no benefit? Take out the emulsifiers, take out the surfactants. That is bad for the gut microbiome. Of course, it's bad for the oral microbiome. These should not be in toothpaste, but they are in toothpaste because that's how you mix big, large batches and make sure that it's well mixed and it stays mixed once it's in the tube. In fact, our first round of tubes were a little squirty. When you would squirt it, they would squirt out because there would be air bubbles in there, and that's because we were playing with this fine line of no surfactants. How do you mix it properly? And we figured it out finally. We were able to make a toothpaste, which is a man-made concept, right? Of this congealed mixture of minerals and prebiotics and xylitol, and we took out the emulsifiers and surfactants. It was not easy.
Some questions I see on Facebook forums and stuff talking about, I feel like every time I open Facebook, by the way, there's another conversation about nano-hydroxyapatite. But there's some people that are like, what about 2% ones? What about 10% ones?
Right.
What do the particle size, like, do they need to be a certain size and shape? Are those things that we need to look at?
Absolutely. So we talked a little bit about that. We talked about that 4-to-1 ratio, rod-shaped, rounded corners, no needle-shaped. There are studies that say that a needle-shaped before it dissolves, which will take a day or two, sometimes longer, depends on what kind of solution it's in, what the pH is. It can be less than that. Distilled water, of course, it would dissolve quicker. But a needle-shaped mineral does cause inflammation in tissue. And a lot of these studies, they take a needle-shaped hydroxyapatite and they inject it into the tissue or into a zebrafish or into organ tissue. And there is an inflammatory response because it takes a while to dissolve. Now, if you were to push in titanium dioxide, syringe it into tissue, it's there forever, and your body cannot get rid of it. So that's going to be chronic inflammation for the rest of your life. This is a digestible product, and a needle-shaped nano-hydroxyapatite is probably not a good thing, although it's already in toothpaste. There are a lot of toothpastes out there that have a needle-shaped hydroxyapatite shape and form. You want it to be uncoated. The maximum is up to 10%. To answer your question about percentages, we kind of wondered about that too. The two studies, that one manufacturer that keeps citing that 10% is optimal and anything less is not. There were two studies. They were performed in China, 2009, 2011. The researcher's name was Huang, and that was done before we had defined that the industry and the researchers had defined the size of nano, the actual size. So one of those studies actually was referring to a particle size that was larger than nano in a micro category above 100 nanometers. And this took hours of looking into because I was curious and research, and we actually reached out to Dr. Stacy reached out to Dr. Huang and the principles of the study. And all those studies that support 10% are true, but they were talking about micro, and micro does work at 10%. You need a lot of micro for it to work, but it doesn't penetrate as quickly, as deeply, and it's a different particle size. So the definition for nano size came in 2014, and again, these studies occurred before that, or right around that time. It may have been 2011. Actually, it was 2011. The first definition of nano came in 2011. Well, the study had already been worked on. Also, what is the source of that nano? Is it ground up bone? Is it synthetic? We actually examined a lot of toothpaste manufacturers before we did our study. We sent it to a lab in San Diego, and they squeezed out all of these toothpastes. And under very high magnifications, we looked at the particle size and shape. And the 10% formula, toothpaste formula, was very erratic. It was like there were big particles, small particles. It was like just a lot of junk. There were some optimally sized nanoparticles, but it wasn't pure 10%. It may have been 3% of the mix, or maybe 2% of the mix. And then there were some needle-sized shaped products, and maybe they were coated. We didn't have enough magnification to see coating. So again, to make a very long story shorter, the study, and then we went to the study, and the study said that the sweet spot is 3.1%. And it's the Fluidity Nova product from Portugal called Nanoxam that won the day. I mean, we have higher remineralization than the 10% formula, than Colgate with fluoride in it. So we just wanted to know, and we wanted our customers to know that we are paranoid about this, and we want to certify and verify that what we're doing and the way we're thinking, which so far has been correct logical thinking, we are producing a product that is superior in every way. Well, in terms of remineralization. And the interesting part of that study, and it will be released, and we'll have someone else release it. We don't want to brag or piss anyone off, but it's going to piss off a lot of manufacturers. There were some non-nano-hydroxyapatite formulas that did pretty well. They didn't do as well as FIG. So it's not about the concentration, to answer your question. It's not about 10% or 1% or 2%. Boca did pretty well at 2.1. It's not about the amount and concentration, and it rarely is in medicine. It's about the quality, the shape, the size, the uniformity, the conformity to an approved version by the SCCS, and it's also about the quality. And it's also, on top of that, this is not about nano-hydroxyapatite, it's about what else is and what else is not in the toothpaste, because that, again, as I said earlier, affects that engine of remineralization, the oral microbiome. Leave it alone, let it do its job, give it the right particle size and the right building blocks of hydroxyapatite, and you've got a winning combination formula.
Okay, that's awesome. I think a lot of us in dentistry, because we've just been totally diligent to this dogma of fluoride for years and years. And now if we start to maybe incorporate nano-hydroxyapatite into our practice, it might be a little awkward. I'm just thinking, how can we start talking to patients as far as why we're making this switch while also hopefully saving face? You know what I mean?
Right. I think that is part of the issue. I think organized dentistry is digging their heels in. I mean, look at what there's a Society of Pediatric Dentists. They're digging in their heels, and they're literally saying, there's a video out there of, I think, the president or the ex-president of that organization saying, we'd rather deal with the issues of neurotoxicity and have better teeth. When again, there's no data that supports that fluoride actually is better than hydroxyapatite. I mean, it's amazing. The ADA is digging in their heels. The EPA is is appealing after a 7-year lawsuit of all the data and NTP and collaboration systemic studies and all indicating that there are issues with a developing brain, even in utero, they are digging in their heels. So there will be some dentists that will not change their tune. There are some hygienists that may not change their tune. And there's a subcategory there. There's some hygienists that can't change their tune because their employer, their dentist, will get upset, right? That's a very interesting category. We can talk more about that later if you want. I hate to see that. But a functional dentist and forthright thinking and ahead of the curve, up to date, reading all the research, and the dentist who wants the best for their patients, but also the best for their family, is going to glom onto all this research, and they're going to stop recommending fluoride. Now, the good news is that there's a big population out there that is coming in and saying, no fluoride. Here's my kid. You can have him for a half hour, do the prophy, but no fluoride treatment. And so what does the dentist do? Do they shame the dentist? That happens. That is occurring, and that is sad. Or provide them with another product that now has a billing code, and that is this fluoride varnish that won the Accelerant Award. And there'll be more, trust me. There's competition coming. We've created this category, and they're all on our heels, and they're going to come out with similar products, and that's great. That's what we wanted to do. We wanted to change that category and clean it up. There will be alternatives that you can bill for. And the beauty of this, and I tell this to all my functional dentists that are on our directory, it's a double whammy. You can bill for it, the insurance company. You can also sell your patient a tube of it because it's not toxic. You can't do that with a fluoride varnish. You can't send your patient home. You can send them home with Prevident 5000, which is 5,000 parts per million. And by the way, we tested that as well. A normal tube of FIG tested better in terms of remineralization than a 5,000 parts per million fluoride toothpaste.
No way.
Which is
Wow.
amazing. Right. So anyway,
Yeah.
and that's a 3.1% Nano-Hydroxyapatite from Fluoride Nova. And that's the best one out there. Again, synthetically made, pharmaceutical grade. Anyway, so if the dentist is worried about income and profitability, which they should be, it's a hard business with a high overhead, you don't want to just yank away that income stream by saying no more fluoride varnish, it's bad for our kids. Most dental practices, they're making $100, $150, $200,000 a year gross on that. And it's the hygienist doing the work, and it takes a few minutes. So I'm not demeaning that in any way. Topical fluoride does work, but now we know it's toxic to the brain. Let's replace it with something. Let's allow the dentist to survive, allow the hygienist to make a recommendation that they feel good about. I mean, how many times have you applied a fluoride varnish and the kid vomits or gets upset or dreads it? I have a story I love to tell. I had a young man, a 10-year-old patient who was a model patient up until the hygienist said, okay, now it's time for your fluoride treatment. Of course, she turned to, prepare all that in the trays and everything. And when she turned around, he was gone. He had jumped out one of our skirt windows. There was a screen there. He punched it out, and he was waiting by the car. His mother, we went out to see his mom in the waiting room and said, he's out there somewhere. Let's go find him. And we found him by the car. And he said, I'm not doing that. I'm not doing the fluoride treatment. Fluoride varnishes have other chemicals in it, crazy chemicals to help dissolve and create that resin-like finish so that it sticks to the tooth. These are very toxic chemicals. The fig varnish does not have that. So, and we have proof of efficacy, proof of life, and that therapeutic effect that we're looking for. And then to be able to sell it to the patient so they can take it home and then they can use it in whatever they want. They can rub it on with a glove. They can put it into a tray. I mean, for their kids that are getting a lot of cavities. So I would say this is a win-win for dentistry. It's just you have to change your frame of mind. And I think it's going to start with the hygienist. My advice to your dentist, to dentists out there, listen to your hygienist. Let him or her make these changes because they're going to educate the patient. They're already going to come in asking for no fluoride. But if they aren't, give them that option. Once they hear what we just said, you could even just give them a little card or a little handout. Obviously, they're going to choose something that they can take home, something that is safer for the child's brain. So I think it's just a matter of education. It always is, right?
Yeah, definitely. I'm just thinking of like my patients who, I mean, I've had a fair amount of patients who have very high caries risk, and they'll come in every 3 months, whether they're getting their teeth cleaned every 3 months or not, but
Hmm.
just so that we can apply fluoride varnish. Now,
Right.
if I had that patient who's been getting fluoride varnish for years, and then now I'm going to say, actually, I'm going to use something different this
Right.
time, I just wonder what verbiage you would recommend on making that switch to the patient so that they're
Right.
not like, what, you've been poisoning me for the last 10 years and now you want
Yeah.
to
Oh, I see
switch to
what you mean.
something
Yeah.
else?
Well, I mean, I think transparency is always the best route. You don't want to say, I've been
Hmm.
poisoning you for the last 10 years of your 10-year-old's life. I would say there's something new, there's something that's better, and it is more likable by your child. And of course, obviously, if it's less of a traumatic event overall, your child, the child patient, will be a better patient. They're not going to dread that visit and give all these excuses not to come in. I would be honest. I would just say, listen, you know what? Fluoride does have some concerns now. And I think if you mention it, you don't have to give them all the detail, but I would say
Yeah.
there are some issues with developmental issues, and we don't want to go there. And so we are one of the first practices in our area to offer this. Of course, it's your choice. What I would do in my practice, I would just say, listen, we have eliminated fluoride from our practice. It's like eliminating metal fillings that with mercury. A lot of
Hmm.
practices have done that. I did that very early on. When I came out of dental school, I just got rid of alloy. My dental assistant said, how much dental alloy do you want? What kind of capsules? What size? And I said, no, we're not using any of that. And that was when composites weren't perfect by any means. There is no perfect filling, by the way, but they've gotten better. So I would eliminate it. And then word of mouth will get, I mean, you'll get new patients from that. And I would be honest. I would say, listen, we were using what we thought was the best thing, and it was stronger and better at remineralization. There was an effect. It was the right thing to do, but we didn't have the data. And I think most parents will be okay with that. You
I
know,
like your comparison to like the metal fillings because I
yeah,
totally get that. And we've
yeah,
kind of, well, not all of us, but a lot of us have moved on from that. So that
right,
makes
yeah.
sense.
The response will be great. It's like, oh my God,
Yeah.
you're thinking of me. You've done the research. You've got it here on the table. Perfect. And I can go home with it if I want.
Yeah, no, that's great. For clinicians who want to dive more into the research, a lot of
Mhm.
us like to do that. Do you have recommendations or resources of things that they can look at?
Definitely. So, my daughter and I have put together what we think are all the best studies, and that's always evolving. It's just a link. I'll give you the link. We can put it in the
Okay.
show notes. It's on our website, Ask the Dentist. It's been up for a while. A lot of research studies. We are adding them, and we also add some of the studies that are involving side effects, but with the needle shaped, and we outline that. We try and each study has a little blurb from me and why it's important. There's also I would go to the Fluidy site in Portugal. They have lots of great data. I would go to the SCCS and the European. The Europeans are ahead of everything. I mean, they're analyzing everything, cosmetic products. Their foods are better. They're not using the same pesticides that we do and herbicides. They haven't even been using certain dyes that we've been using for a long time.
Yeah.
BHA, BHT was removed from their breads a long time ago. That's a great resource. You could also go to Japan, and there's tons of data out there. I would
Uh,
query ChatGPT with a long, complex query. It's amazing what it'll pull up. Give me all the bad safety data on nano-hydroxyapatite, and then compare and contrast that to efficacy. And what is there a safe version that I can use? What is the optimal strength? What are the best brands? I mean, all that data is being sorted pretty well. I have not seen too many hallucinations with ChatGPT and other things. Google has a product that I use often, but you can also just go to PubMed and
yeah.
type in nano-hydroxyapatite. But you have to educate yourself a little bit. When you read the study, and studies are hard to read, and you can take a study and put it into LM Notebook, which is a product that Google makes, and it will break it down for you. But remember, make sure that it's a recent study. The older studies, there's a lot of mistakes being made in the older studies. So I would stick to 2020 and beyond. Again, those studies I referred to from China, I mean, they were interesting studies, but you have to make sure you understand what material they're using, what is the source of the material, and what is the actual shape and size and coating and strength. And I've spoken to a lot of researchers, and we have compiled a list, which we really haven't publicized yet, but we will because it's so complicated. It's not really for the layperson. We also have a continuing education course that Dr. Stacy and I did. Dr. Stacy does a presentation for dentists. I'll give you the link for that. It's about an
Okay,
hour.
great.
It's a lunch and learn on everything you need to know for hygienists and for dentists on hydroxyapatite, how to incorporate it into the practice. If a patient comes in and says, oh, that's bad for my liver, or it's going to calcify my pineal gland, what the facts are. And then, of course, there are a lot of studies that we refer to in that lunch and learn. That would be a great place to start. But look at the data and make sure you're reading it correctly. There's a lot of misleading. It's not that the study is giving us the bad data. It's how we interpret that data. And then it gets out on Instagram. So be careful where you're getting your information from. If it's from Instagram, and that includes everything I say, make sure it's backed up with studies, make sure it's reasonable. There's so much information out there now.
I'll put the links for the resources that you mentioned in the show notes, as well as the ones that you send me. That's great.
Okay.
Before we wrap up, I do want to hear about this varnish that you have, because as far as I know, that's the first nano-hydroxyapatite varnish, right? Is it applied the same as fluoride varnish that we're used to?
It's a great question. Again, we took out all these chemicals. I forget what hexane and just if you look at the MSDS on these things, it's pretty bad stuff. It can burn tissue. It tastes terrible. I mean, this is why the kids go nuts. That's why they vomit. It's not the fluoride amount. Perhaps it is, but it's more than that. So it's a different consistency. It has the same efficacy, slightly better, depending on which study you read. It is the first of its kind that we're aware of. There is a varnish out there that has a lot of fluoride, and they added a little nano-hydroxyapatite to it. I think that was just for marketing purposes.
Just to put the name on it?
I think so. It's just like what toothpaste companies did back in the 60s. They put fluoride in their toothpaste at, 1.1, 1.45 parts per million because it was in the water, and it was the greatest discovery of mankind when it came to preventing decay, which we found out it wasn't. So anyway, the varnish can be used at home. You can rub it on with your finger. It's not quite as sticky. You can load it into a tray. That is probably the best application of it. It tastes great. It's got a little bit of a mineral taste to it, but it is 1,000 times better than any fluoride varnish out there because we took out all those chemicals. It's not like you're drinking ammonia hydroxide and Windex and Lysol all at once. I mean, it's ridiculous. I mean, those things are horrible. Of course, kids react that way because it's instinctual. They know it's a poison. And it doesn't have 24 or 25,000 parts per million of fluoride that will get to the brain within 10 minutes. That's a big dose. And it sometimes, as you said, happens 4 times a year. So it's the same price. We priced it exactly the same. For dentists, we have a wholesale program. Patients obviously are like a tube of varnish for $124, but that's what it costs for the dentist. But you can use it over a period of 3 to 4 months, and it works. It's stronger. After it's been mixed down and mixed with toothpaste, it's an 8.6 percentage of hydroxyapatite. We talk about that in the lunch and learn. A lot of dentists will say, yeah, but there's a toothpaste out there with a 10%. Well, the 10% did very poorly compared to our 3.1% toothpaste. So the 8.6% is stronger. And of course, we compared that to the best-selling varnish in the world, made here in the US, and it was as good, if slightly better, in terms of remineralization. So it puts it all into perspective. It's not about the percentage. It's about the quality and the delivery. So it can be used in the dental. We have a lot of hygienists using it. Our wholesale program is probably 30% of total sales. So a lot of dentists have jumped on board. It's a little less thick, less stickier, but it can be painted on. After the prophy is the best time to do that. And the best part is that the kid's just sitting there going, this tastes like vanilla or cookie batter. And again, we had to mask that mineral flavor because there are a lot of minerals. There's a lot of calcium and phosphate in there. But it works. It works. So it can be used in many different ways. My favorite is in an Invisalign tray or a foam tray. It's perfect.
Okay. So it can be applied, do you have single-use applications for the office?
Oh, it only comes in a tube. We do not have the single use yet. Single dose. We're thinking about that. That significantly increases the price. We haven't gotten too many requests for that. And again, it's a lot of, for the environment, you're disposing of a lot of things. But we did entertain that.
Yeah, I appreciate the not wanting to contribute to the waste thing. That's a whole nother topic. So if
Yeah.
people want to reach out to you, learn more about you, maybe schedule one of those lunch and learns, what's the best place for that?
Well, I can give you all the URLs. I'm happy to give you my email address. We can put that in the show notes. If you're
Okay.
a clinician and you have a specific question and you're confused, which I get, I mean, I can sit here all day and look at research. Being a clinician is difficult. It takes up a lot of your time, and you're doing the best thing you can for your patient. And that, I mean, you take it home at night, and it's not easy. So, and you're managing a business. So I get that, and you need help. So we're here to help. Dr. Stacy and I are here to help. We have resources online. I wouldn't force the decision. Just think about it. But I think it's being made for you by your customer. I think that's what's happening, and maybe by your registered dental hygienist. And overall, I would say listen to your hygienist.
And our patients are asking about it. This fluoride thing is a big deal. And so
It
they're
is.
looking for options. And I think we at least need to be educated on what
Right,
else is out there, if not offering it ourselves.
right, right. Now's the time. I mean, obviously, we've been caught with egg on our face because we've been promoting it and promoting it. And despite all the data that's been out in the last 15 years, and now really, I think it's time just to scrape off the egg on our face and just say, okay, sorry, we made a mistake. Let's go with this because it works. I mean, isn't the ultimate goal the benefit of our patients, our better health,
It
less
should be.
decay? I mean,
Yeah.
then why not go with a better product? I mean, let's forget about how we feel. Okay. Let's not make it about us. Let's make it about the patient.
Yeah, and I think I said this recently on another episode, but it is totally fine for us as clinicians to change our mind. Just because we've recommended fluoride for 20 years,
Of course.
we don't have to still do that if we don't want to, especially
Right.
now with options like this. So,
Right. And I don't think our patients are going to be suing us or telling us that we're quacks and all that. I mean, they understand. But if you dig your heels in now, the egg on the face is going to get even worse.
oh, yeah, and talk
Yeah,
about breaking trust. That's
exactly.
like if you just double down on it and
Yep.
with all this research, it's not going to look good for you. Well, thank you so much, Dr. B, for coming on. I'm going to put all of it, like, there's probably going to be a ton of links in the show notes this time, which is
Perfect. Love
great.
it.
But thank you so much for your time.
Thank you very much. It was a lot of fun debunking and talking about what I think is a very exciting part of dentistry.
100%. And thank you everyone for listening, and we will see you next time.